Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hypervitaminosis A. So vitamin A excess can be present in two forms. So there are two forms. That is the vitamin A toxicity as well as the carotenemia. So it is a vitamin A toxicity as well as the carotenemia. So hypervitaminosis A, it results from the overconsumption of non-prescribed nutrition supplements. So hypervitaminosis is a result of the overconsumption. So overconsumption of the non-prescribed nutrient supplements. So what is non-prescribed nutritional supplements? And it contains vitamin A derivatives and foods high in vitamin A. So it contains the vitamin A derivatives and also the foods high in vitamin A. So vitamin A rich foods. Next, let's move on to, then there is a carotenemia. So what is this carotenemia? So carotenemia is nothing but a benign disorder. So this is nothing but it's benign disorder, and this is caused by the excessive beta carotene intake. So it is due to the excess beta carotene intake, and in case of the carotenemia, so in this carotenemia, carotenes are excreted from the sebaceous gland. So the carotenes, they are excreted in the sebaceous glands. So seb glands as well as the sweat glands, and it is ultimately deposited in the stratum corneum. So this is deposited in the stratum corneum, and this leads to the keratinoderma. So keratinoderma. Then let's look at the acute vitamin A toxicity. So in terms of the acute vitamin A toxicity, so here it manifests with the headache and vision changes. So there is presence of the headache. Next there is vision changes. There is fatigue, anorexia, nausea, vomiting. Fatigue, anorexia, nausea, vomiting, as well as the myalgias and the arthralgias. So the weight loss, it can be observed with the chronic intoxication. So the weight loss, you can see it with chronic intoxication. Then when you look at the individuals, now in terms of the individuals, and this is with the chronic hypervitaminosis. So in terms of chronic hypervitaminosis, so hypervitaminosis A, so they have a dry and scaly skin. They have presence of dry. So there is dry as well as presence of the scaly skin. Next is they also have the desquamation, the cheilitis, then is alopecia, follicular hyperkeratosis, as well as the hyperpigmentation. So there is hyperpigmentation as well, and it is associated with the pseudotumor cerebri. So what is it? It is associated with the pseudotumor cerebri. tumor cerebri. As well as there are some skeletal changes, and that is the premature closure of the epiphysis. So there is premature closure of the epiphysis, as well as there can be pathological bone fracture. Now let's look at the prognosis. So under the prognosis, there is a vitamin A toxicity. So vitamin A toxicity is to discontinuation of the vitamin A leads to resolution of almost all symptoms of vitamin A. So there is discontinuation of vitamin A of the vitamin A. It leads to the resolution of almost all symptoms. So there it leads to the resolution of all symptoms. And this is of the vitamin A toxicity. This is of the vitamin A toxicity. And with an exception of cirrhosis and the sequel to pseudotumor cerebri. So there is an exception with an exception of cirrhosis. So there is an exception of cirrhosis as well as the sequel related to the pseudotumor cerebri, as well as the sequel which is related to the pseudotumor cerebri. Then we move on to the carotenemia. So here in carotenemia, there is an excellent prognosis and with no clear long-term adverse effects. So there is no clear long-term adverse effects. There are pigmentary changes which resolves within weeks to months. So there is presence of the pigmentary changes which resolve within weeks to months. So it resolves within weeks to months, within weeks to months. And this is of decreasing the beta carotene intake, with decrease in the beta carotene intake. To learn and grow daily like this, please do subscribe.